Hi there, I'm Sonia Stanojevic. I'm a respiratory epidemiologist based in Halifax, Canada. My work looks at understanding how the lungs grow and develop. I'm currently the chair of the Global Lung Function Initiative, and it's my pleasure today to introduce Refiloe Masekela. Refiloe is a pediatric respirologist from South Africa.
Thank you very much for the introduction to VIA firstly, and for your great work and support of GLI for the African continent. I'm currently the Vice President of the Pan-African Thoracic Society, as well as the Director of the Spirometry for the Pan-African Thoracic Society. And as one of our goals, we would like to collect normal or healthy lung function data to be able to contribute this to the GLI data set from the African continent.
So the Global Lung Function Initiative has worked very closely with many respiratory societies around the world. We have a very close partnership with the European Respiratory Society, and they're our main sponsor of the work that we do. But in recent years, we've gotten very involved with the Pan-African Thoracic Society, and with Refiloe's leadership, we've really been able to start working together to bring the work that GLI does to the African continent. And we've been able to better understand what lung health looks like in people that live in Africa, and also the challenges that we have in bringing equipment to the African continent and the expertise to be able to measure lung health in this very important region of the world.
I think if we look across the African continent, post-TB lung disease is becoming a serious and significant issue. Many non-communicable diseases like asthma, COPD are on the rise, and these are still causing a high level of morbidity and mortality. But in order for us to diagnose pathology, we need to have good quality spirometry that is able to be conducted even at the primary care level, references that we know are applicable locally, and having access to equipment that would be useful to objectively quantify the burden of disease is very important.
With Refiloe's research and how she has been engaging with communities across the continent, and now with additional equipment and consumables, we're able to reach more people, and we're able to get to communities that haven't been able to contribute or participate in research studies before, filling a major gap in our understanding and knowledge of lung health around the world, and particularly in Africa. So this project that you're hearing about today is really one of the key first important steps in moving forward in better understanding lung health globally. Because VIA has direct access to the people who use lung function, we've really benefited from a partnership where we hear what people are struggling with, we hear what happens every day in clinical practice and how the Global Lung Function Initiative can help. But more recently, VIA has become an important partner because they have contributed equipment and consumables to the work that Refiloe is doing in Africa.
Thank you very much for the very, very generous donation of equipment to PATS. We have received the equipment. It's for us to train people locally in at least at the onset in about 10 centers across the continent, so that we would have a reasonable number of hubs with people with training on the equipment. And in terms of rolling out the field work, we're looking at a timeline of between the next 4 to 5 years, where we should have the data collected, cleaned, analyzed, and for us to have a reasonable understanding of the kind of data we've been collecting at the various sites.
Thank you so much, Refiloe, for joining me here today. It's been such a pleasure to hear about your exciting work in Africa, and I know I'm excited to see the results in the next couple of years. I'd like to thank VIA Medical for hosting us today, but also for their generous contributions towards this project. And in general, I'd like to thank VIA Medical for supporting the Global Lung Function Initiative over the many years that we've been working together. I can guarantee you that the work of the Global Lung Function Initiative is not done, and I very much look forward to continuing to work with this community to help and improve lung health of people around the world.